Now we'll be discussing oral contraceptives, their mechanism of action and adverse effects. Firstly, we have combination pills. Combination pills contain estrogen, usually ethinyl estradiol, and a progestogen. They are taken for 20 to 21 days and discontinued for the following 6 to 7 days to allow menstruation to occur. Now, progestogen-only pills contain a low dose of progestogen, for example, norethistérone, and are taken continuously. While enzyme-inducing drugs like phenobarbital, carbamazepine, phenytoin, and especially rifampicin may cause failure of contraception. Now, how do oral contraceptives act? Well, combination pills act by feedback inhibition on the hypothalamus to suppress gonadotropin-releasing hormone and hence plasma gonadotropin secretion, thereby blocking ovulation. These drugs also produce an endometrium that is unreceptive to implantation, alter fallopian tube motility, and change the composition of cervical mucus. These latter effects are also produced by progestogen-only pills and appear to be the basis of their contraceptive actions because they block ovulation in only about 25% of women. Menstruation often ceases initially with progestogens, but usually returns with prolonged administration. However, the length and duration of bleeding are very variable. Now, moving on towards the adverse effects. Non-life-threatening side effects that occur with both combination pills and progestogens include breakthrough bleeding, weight gain, changes in libido, breast soreness, headache, and nausea. Combination pills may also cause hirsutism, vaginal yeast infections, and depression. About 20 to 30% of women will experience some of these effects, and 10 to 15% will stop taking the pill because of them. Serious side effects are rare. They include cholestatic jaundice and a slightly greater incidence of thromboembolic disease, for which the estrogen is apparently responsible. Combined pills containing gestodine and desogestrel are associated with a slightly higher incidence of thromboembolism. However, the absolute risk of thromboembolism is very small, about 25 incidents per 100,000 women per year. A history of thromboembolism, cigarette smoking, hypertension, and diabetes increases the thromboembolic risk of oral contraception. Well, oral contraceptives are probably associated with a small increase in the risk of breast cancer. So that was all for today. For more such videos, keep watching sqadia.com.